Thank you, Madam Speaker. We in Congress and the new administration have been given a gift of opportunity to solve some of the long festering problems with the American healthcare system. One opportunity to achieve true reform is to provide greater value to patients when they are most vulnerable, when loved ones are facing the last few weeks of life. Today, these patients have a wide variety of treatment options available. We can test them, hook them up to machines, poke them with needles, perform all sorts of heroic measures. And where appropriate, we can accomplish amazing results with virtually no cost to older citizens. Yet when it comes time to help people understand what their choices are, to have their questions answered, to be able to shape treatment for what their values and interests might be, we fail them utterly. House Bill 3200, health care reform, does have a simple solution to empower people and their families. Yet this carefully crafted provision has been attacked by some opponents of reform. For example, Betsy McCauley in the Wall Street Journal claiming wildly that somehow this would be mandatory, that it would be done by an assigned physician, the threat of coercing senior citizens. A simple reading of the provision shows that that's simply not the case. Like all other Medicare provisions, it would be voluntary. It would be by the physician of one's choice. And there's nothing mandatory about it. It has led the American Association of Retired People to issue a statement about this opinion piece in the Wall Street Journal. Ms. McCauley's criticism misinterprets legislation that would actually help empower individuals and doctors to make their own choices on end-of-life care. This measure would not only help people make the best decisions for themselves, but also ensure that their wishes are followed. To suggest otherwise is a gross, even cruel distortion, especially for any family that has been forced to make the difficult decisions on care for loved ones approaching the end of their lives. The AARP makes clear, quote, "We will fight any measure that will prevent individuals and their doctors from making their own health care decisions. But we will also fight campaigns of misinformation that vested interests are using to try and scare older Americans in order to protect the status quo. Profits should never be allowed to come before people in this debate." And sadly, it's not just right-wing pundits who are involved with an effort of distortion. I would hope that my friends in the Republican leadership would reconsider their ill-advised attempt to equate this bipartisan effort to empower families with a slippery slope on pressuring seniors or even euthanasia. This is simply categorically false and destructive. The provision in question was carefully considered. It was the result of real bipartisan cooperation to help families. Indeed, some of the most moving comments in our committee deliberations came from Republican colleagues who talked about the concerns that they faced with their families in this difficult end-of-life situation and how we needed to do better. Madam Speaker, there are lots of areas that we can disagree with as we're dealing with health care reform. By all means, let debate and disagree over areas of genuine disagreement. But let's not attack this long overdue assistance to families facing the difficult situation of end of life. Let's not attack it. Let's embrace it. American families deserve no less.